Did you find yourself, especially you woman after 50 years and older, that you are chronically tired, you have chronic fatigue, you have a lot of weight, especially weight gain after 50, you have the brain fog, and someone did really discover that you have thyroid problems. And right now your blood tests look normal, you take medication each day, but something is really off. You don't feel any kind of improving your situation. With your thyroid problem, probably the missing thing that you really need to remember is probably chronic deficiency in special minerals that you need each day. There is a very high chance that you've been treating the wrong way and most people are told everything is fine. Or they are given a thyroid medication that only adjusts hormone levels, but their symptoms never truly go away. And one of the most dangerous mistakes today is trying to fix this using internet advice, random supplements, or non-expert recommendation. And of course, you use every day those chemical medication, and each month, each year, you're getting worse and worse and worse. Something is really strange, my dear viewers, and today I'm going to give you explanation why this happens. What is really happening is not just a thyroid problem, it's nutrient deficiency problem. The thyroid does not suddenly stop working, it becomes weaker over time. It is not getting the nutrients it needs for the proper function. Modern treatment focuses on hormone replacement, but it does not restore the thyroid itself. That is why many women continue to feel fatigue, brain fog, low energy, and the weight gain even when they are on the therapy. So this means, in short, my dear viewers, your chemical medication does not by 1% improve your thyroid functions. You think, because your doctor tells you this, if those kind of chemical medication that you use for your thyroid works, you will be drinking them for the couple of days, couple of weeks, and your thyroid will be perfect, and you will not need more of those chemical medication in your life. Unfortunately, that is not the case. In the most cases, you need a thyroid chemical medication each day for the rest of your life. Unfortunately, they come with a lot of side effects. Why your thyroid is starving? Your thyroid depends on very precise balance of minerals to produce or activate hormones. And three of the most important are selenium, iron, and the zinc. Without these key elements, the thyroid may still produce hormones, but the entire process becomes inefficient, unstable, and incomplete. Selenium is essential for converting T4 into active hormone T3, which is form your body actually uses at the cellular level. Without enough selenium, this conversion slows down significantly. And this means that even if your thyroid production, if thyroid is producing hormones, your body cannot properly activate them. As a result, your cells remain in low energy state, leading to fatigue, mental fog, and a slow metabolism. And over time, this creates a situation when the lab results may appear acceptable, but your body is clearly not functioning normally. And one of the main reasons, probably you already did hear about selenium, you have chronic selenium deficiency, your thyroid not working properly, and that is just one of the reasons why you have chronic thyroid problems and all those symptoms that never go away. My second recommendation that is so important for your thyroid is, of course, going to be iron. Iron plays a critical role not only in the oxygen transport and energy production, but also directly in the thyroid hormone synthesis. The thyroid gland requires iron-dependent enzymes to produce hormone effectively. And when the iron level drops, the entire production process becomes weaker and less effective. And this leads to reduced thyroid output, lower energy, poor concentration, and increased physical exhaustion. And many women after 50 are especially vulnerable to this because iron absorption decreases with age, and chronic inflammation further reduces its availability. Yes, my dear viewers, that's why you need to check if you have thyroid problem. That's selenium, of course, you need to check iron levels, because those are really connected, and they work in our body to protect our normal functions of course, thyroid. And my third recommendation, of course, is going to be zinc. Zinc is equally important because it regulates communication between the brain and the thyroid gland. And it supports hormone signaling, immune balance, and protects thyroid tissue from inflammation and oxidative stress. Without enough zinc, the feedback loop between the brain and thyroid becomes disrupted, and this leads to unstable hormone levels, reduced efficiency, and the higher risk of autoimmune process affecting the thyroid. Another critical factor is that those minerals do not work properly. They function as a part of coordinated system, and deficiency is one of the leads to imbalance of the others. For example, the low zinc can impair immune regulation, which increases inflammation, which then interferes with selenium-depleted processes. In the short, this means all of those minerals and vitamins work together in our body. And you did never heard, no one did tell you, especially this didn't tell your doctors, that nutrition, proper natural remedies, minerals and vitamins play a crucial role in our health. Especially today we're talking about thyroid gland, my dear viewers. And if you don't believe in nutrition, natural remedies, minerals and vitamins, you will think that this is something that is not so important for your health. Look all around you, my dear viewers. There's over 100% more problem with thyroid right now than 20 or 30 years ago. This is especially important for you women after 50 years and older. When those minerals are missing, the thyroid becomes starved. It is not receiving the fundamental building blocks it needs to sustain normal function. And hormone production becomes inefficient, hormone conversion is impaired, and cellular response weakens. And this is when symptoms begin to appear gradually: persistent fatigue, weight gain, cold sensitivity, low motivation, and the brain fog. And the most dangerous part is that this process develops slowly, and many people adopt those symptoms over time and begin to accept them as normal aging. And there is nothing normal with those symptoms. I see it every day for the last 26 years when I work with my patients. They only tell me, I drink a lot of medications, I have so much symptoms, but this is just normal. I'm 55, I'm 60, I'm 65 years. This is just normal. I have aching, I have the brain fog, I have obesity, I have the liver problem, whatever. This is just normal part of aging. Nothing about this is normal. The most terrifying thing is that we accept this as a normal part of aging. When it comes to supporting your thyroid with selenium, iron, and zinc, dosage and the form are just as important as the mineral itself. Taking the wrong form or incorrect dose is one of the main reasons why people do not see the results. Selenium is one of the most critical minerals for thyroid hormone conversation, and the recommended daily dose for the adults is around 100 to 200 micrograms per day. And the best form is selenium methionine because it's highly absorbable and stays longer in the body. And of course, I'm going to recommend you right in this part of the video best form of the supplements that you can take that if you are discovering that you have all those nutrient deficiency problem and you have also thyroid problem. Those selenium methionine is one of the best for your problems, but of course it must be from the best sources, best organic product for best companies in the world. I tell this almost in a couple thousands of my videos. Almost 99% of those natural remedies, or those supplements, are very poor quality, cannot help you. Maybe 1% are a good pure organic form, and I'm going to recommend you this. Of course, the best way for your minerals to be incorporated in your body each day is going to be perfect food, but for today's video I'm going to recommend you supplements. So first is selenium methionine, second is going to be iron. It's essential for thyroid hormone production, but it must be used carefully. The typically daily dose ranges from 15 to 30 milligrams per day, depending on individual needs and deficiency level. The best form are iron bisglycinate or iron fumarate, because they are better absorbed and less irritating the stomach. It is very important to know that iron should not be taken blindly. Levels should ideally be checked, because both deficiency and excess can create the problems. That's why you need medical assistant. Everything that you do, I'll tell you also in today's video. You cannot be your doctor watching my video. This is 100% forbidden. This is just for the educational purposes only. You must find good quality medical profession that will just for you make those natural remedies, minerals, vitamins, diet program, especially for thyroid, and everything is going to be perfect. And my third recommendation is going to be zinc. Zinc play a key role in hormone signaling and immune balance. And the recommended daily dose is usually between 15 and 30 milligrams per day. And the best format, zinc picolinate, zinc bisglycinate, or zinc citrate, because they are high bioavailability and are well tolerated. Long term of zinc should be balanced with the copper to avoid mineral balance. This is all something that is very common. A lot of you never realize it. First step for me, and this is my recommendation, of course, is going to be for you. Check your blood test. Go to your doctor, check selenium, check iron, and check zinc. And if you have thyroid problems and you have some of those deficiency, you will be correct them maybe so easily that you will not believe it.